Hello, I'm Dr. Patricia Madrigal. I am an integrative doctor and I work in Clinica San Jose, Costa Rica. Today, I'm very honored to present you Dr. Tom O'Brien. Dr. Tom O'Brien is an specialist in functional medicine. He's an expert in autoimmune disorders and gluten-related disorders. He's the author of the books The Autoimmune Fix that you can find also in Spanish, and You Can Fix Your Brain. Hello, Dr. Tom. Thank you for being here and for sharing with us all your knowledge and for accept my invitation. Thank you, Dr. Tom.
So I would begin by this quote that all of us in healthcare have heard before, we may have forgotten. Prevention is the ultimate principle of wisdom, and this has never been more true than it is today. To cure a disease after it has manifested is like digging a well when one is thirsty or forging a weapon after the war has begun. Unfortunately, with this current pandemic, we are noticing that for many, many people, their well is dry. And so they are having symptoms. They are demonstrating an immune incompetence to dealing with this virus. And I will show you the studies as to this situation and what can be done to help these people. I will begin by telling you all of the slides I'm showing you, and all of the studies that I'm quoting for you are available to you. If you go to my website, theDr.com /Clinica, they will be there for you within a couple of hours. I just told my staff this morning to do this, and so they're panicking a little bit to get it done. But it will be done within the next few hours so that they are all available to you. And feel free to post your questions in the Q&A section, and when my presentation is done, I will go to the Q&A for the questions. The clinical features of COVID are well documented, with most people displaying mild symptoms or no symptoms at all, and deaths occurring mainly in the elderly and the chronically ill. This is something that we know, but we forget, and people are in a panic right now. This came from the British Medical Journal in late February. No vaccine or antiviral agents are available, and the mainstay of treatment is supportive care in high dependency units if necessary in the hospitals for the most critically ill patients. In other words, they're just trying to support them in getting through it. There is no treatment that's been consistently accepted for COVID-19. There are some things I will talk about that have come up out of China and out of Europe and now being implemented in the United States that are seeming to be of benefit. This is not the public perception that most people don't get sick. The public perception is panic, as played out in the media and reinforced by gunpoint quarantine. So what these authors are suggesting is that we may need to take another look at the amount of stress that people are under and calm down our patients and let them know that the vast majority of people will be okay and give them some things that they can do. I've put this study in here because it tells us in the US every year for the last 10 years, 23,000 to 61,000 people die every year from the flu, just in the US. I don't know the numbers in Costa Rica, but proportionately, they're probably similar via population. But every year, we lose 50,000 people to the flu. And we now have crossed 80,000 deaths in the US, but it's not that far out from what happens every year. And so we want to keep that in mind here. Those that must go to the hospital, this just came out last week. Those that must go to the hospital mostly are adults 65 and older. I'll show you some statistics on that. 89% of them had underlying morbidities. Hypertension is most common, obesity is very common, chronic lung disease, diabetes, and cardiovascular disease. So people have other conditions of dis-ease. They have degenerative conditions, lifestyle diseases. As you all know, every one of these is a lifestyle disease. And they are the ones that are most vulnerable here. If we look at these numbers that just came out last week, and if we look at the hospitalizations by age bracket, you see the percentages of people in different age brackets. And if we look at what percent of them have an underlying condition, you see that even by age bracket, those that are having to be hospitalized have underlying conditions. So these are the people, these are the patients that we really want to focus on right now at home and be giving them instructions how to calm down the inflammation in their body right now. As you know, these underlying conditions are all inflammatory diseases. And so we want to calm down the inflammation to help protect them from having to go to the hospital. And interesting to note, half of every age bracket, almost every age bracket that has to go to the hospital, they have obesity. And we know that obesity triples the risk of having a severe reaction to a COVID exposure, triples the risk. I'll show you the studies. If you are overweight, it doubles the risk. Why? Because being overweight and that midsection extra fat that we're carrying produces 17 hormones that are inflammatory. Of the 19 hormones produced by the belly fat, 17 of them are inflammatory. And so these people have just chronic, continuing inflammation markers in their body, and it puts them more at risk of having a severe reaction to the exposure to the virus. So these are the people, these are the patients we really want to focus on right now, and giving them guidance on how to calm down their inflammation. We'll talk about how to do that. And my mentor, Dr. Jeffrey Bland, the founder of functional medicine, tells us that people who are having a reaction to this virus, they have a lifestyle disease. They have a lifestyle contributed imbalance in their body. Their immune system is not capable of dealing with this virus. The vast majority of people will have no symptoms whatsoever who are exposed to the virus. I'll show you the statistics. The vast majority, they never know that they were exposed to the virus. Some, and I'll show you the numbers, will have a little bit of a sore throat, a little cough, a little bit of a fever for a day or two, and then it's gone, and they're fine. And then others will progress. Well, even those that have the cough, the low fever, the sore throats, their immune systems are not working up to par. We think, oh, good, you got through it fine, you're fine. No, their immune system is compromised because the vast majority of people who are exposed will have no symptoms whatsoever. They don't know that they got exposed. And we'll talk about testing and how valuable testing will be to confirm that they've built up immunity, testing for antibodies, but they never got sick, so that they don't know that they're exposed. That's the ideal situation, that when we get exposed to this virus, and most of us will, that we never know, we never get sick. That's the goal. So we know that the percentage of the population exposed to the virus, it's not confirmed yet, but the estimates from our epidemiologists are 40 to 70% of the world population will be exposed to the virus. And symptomatic patients need to be isolated to prevent infection. Voluntary quarantine is very helpful right now to lower the peak number of people that are having to go to the hospital. The benefit of voluntary quarantine is to reduce exposures for those people that will get sick, so that we're not overwhelmed by the number of people that are having a severe reaction all at once. That's one of the benefits to voluntary quarantine. Focused hand washing, we all know to be, and washing your hands for 20 seconds or more. And we have to teach our patients of this because if you order something that's delivered in the mail, you get a box, somebody had to fill the box. So they were touching the box, and you have to open the box, take out the things that are in it. And we know this virus can live on cardboard for 48 hours. It lives on glass surfaces for 4 to 12 hours, depending on what study you read. But some of the surfaces can hold the viral droplets. And so when you're opening packages, when you're getting groceries, we have to be conscious as we're opening things, not to be touching our face. And when we're done and we've washed the vegetables and we've put everything away that we've ordered, we then wash our hands thoroughly. Very important because of the attempts to reduce exposure. Social distancing, of course, the schools are closed, the churches, the universities is also being very helpful. Now, once you're exposed to the virus, the mean incubation period is 5 days. If you're going to feel something, most people will get a sore throat, a little bit of fever within about 5 days. There is some variance, people outside of that, but the vast majority within 5 days. Sore throat, mild cough, slight fever, some GI complaints, little diarrhea, little gas, some bloating, loss of a sense of smell, hyposmia, or reduction in smell is also being identified. Patients with COVID present with fevers in 85% of the cases during their illness, but only 45% have fevers in the early stages. What does that mean? People who don't get a fever until later, when they're really sick, their immune systems are much more compromised. Fevers are a benefit. And I'm not showing you the studies today. I had to decide which ones to show you and which not to show you. But there are many studies that talk about the benefits of fevers. It's our immune system's way of creating an environment that kills a virus or kills bacteria. Now you want to monitor fevers up to a consensus is about 103.5 is fine. Do not lower that fever. Let the body do its thing. Keep people hydrated, well hydrated, and keep them warm. But up to about 103.5, say thank you. Thank you, immune system. Thank you for helping me deal with this thing. Now, in the big picture, fever is a backup. When the initial innate immune system, your monocytes and your macrophages, are not capable of getting the job done, a backup system is to generate a fever. So we want to recognize our patients who do have fevers and then they get fine, they're better. They have an immune system that's compromised. And in the future, you will want to work with them to strengthen the immune system for the next time there's a virus that comes up or a bacteria they're exposed to. So don't forget, fevers are beneficial. We're grateful for them, but they're backup. They are not the first line of defense. So we want to allow the fever up to about 103.5. We want to keep them well hydrated and warm, but we also need to recognize as physicians, this is a backup system. Why did the backup system had to get activated? So keep that in mind to work with those people in a few months down the road and begin educating them on what is it in their lifestyle that is compromising their immune system. So about 20% of those people who develop mild symptoms within the first 5 days or so will progress and need to go to the hospital in the next 7 to 12 days. That's been the average seen all over the world. That's how quickly this virus moves to a stage of where people are getting really sick. Once again, I'm going to give you all of the studies so that you can review these for yourself. Now, this is a very important point. The reason, and the only reason that we know of, as to why the number of people infected who need to go to the hospital with more severe symptoms is 20%, is because of an inadequate function of that person's immune system, their innate immune system. Their innate immune system was not able to handle this efficiently enough by itself. So this is an extension of what I said for those in the first 5 days. If they have symptoms, it's good that they have a fever. It's good that their body is fighting this, but there's something wrong with their immune system that they got symptoms. We accept it as normal. It is not normal. It is common, but it is not normal. Big difference between the two. So please recognize people that get symptoms from exposure to this virus, and even more importantly, people who have to go to the hospital, their immune system, their innate immune system is being compromised or has been compromised. So after they are out of crisis, you'll want to investigate why is that person's immune system compromised. What is it? Is it food sensitivities? Is it toxic metals? Is it petrochemicals? Is it mold in the house? What is it that you'll want to investigate for that person in the months to come to identify the trigger or triggers that are compromising their immune system function? First, get them out of crisis, of course, but then investigate why did they get into crisis. Now, when symptoms increase and the patient has to go to the hospital, many people are being sent home and told to stay isolated unless they have shortness of breath. If they can't breathe, they're being accepted into the hospital to be monitored very closely, because this thing can turn in 24 hours. And if they're having some shortness of breath in 24 hours, they can die. That the pneumonia, the cytokine storm that's occurring is very quick if it gets to that stage. Very similar to the 1918 flu in terms of that presentation. And if they're accepted into the hospital, we know it's the ventilators and the respirators, and the healthcare workers are running short on protective equipment in many countries of the world, and they need more beds and more nurses and more ventilator therapists. So that has been the concern for the last few weeks in most countries of the world. 30% of those that are hospitalized will be moved into critical care. 30%. 50% of those moved into critical care will die. Those are the numbers right now. So this is very severe. Everything we can do to keep the person from having to go to the hospital or keep the person from having to go into intensive care is very important. And we'll be talking about some of those things. If they go into intensive care, the numbers are really bad. So you have to go to the hospital. This is what it's like right now. There's no treatment. If they go into intensive care, there's no treatment. There's a lot of papers coming out right now that the respirators and the ventilators, they're not working for many of these people. Why are they not working? And there's a number of theories coming out that maybe in a follow-up, we can talk about some of those. What about the people who are sent home? What can we do for them when they're in isolation at home? Those are the most vulnerable people right now. Is there anything we can do to reduce that 20% number so people that get mild symptoms will not progress and have to go to the hospital? This would take the load off the hospitals. So your care for your patients who are isolated at home right now with telemedicine is critically important. The guidance that you can give to them to help stabilize them can make the difference. as to whether they eventually will have to go to the hospital or not. Critically important. So there's two windows, two target groups that I look at. One is those that were exposed on day 0 and through day 5. They never got any symptoms. Targeting that group, supporting them, making sure they're continuing that lifestyle, because this whole thing about being quarantined at home and the isolation, unfortunately, there's more family abuse occurring now, spousal abuse. People, when they go to the grocery store, the middle aisles of the supermarkets are empty. The shelves are empty of cookies and bread and pastas and prepared canned foods. And the outer aisles of the vegetables, people are not buying as many vegetables. So we need to educate them that their diet has to be an anti-inflammatory diet. And what are some of these spiritual or emotional things that they can do at home? Whatever efforts you can take as practitioners to reach your people on a large basis, to talk about exercises they can do at home, interactions they can have. It's time to rekindle the love between spouses who have been married for 30 years, or having different conversations with your children, getting them off of their computers or their smartphones for a while, doing things as a family. Those can be very, very helpful. So I'm going to give you a number of options to look at. I hope you will include most of them in your approach with your patients. The first one is the foods we eat. We know that every degenerative disease is a disease of inflammation. Every one. At the cellular level, the cell is on fire. Every one. It's just a question, is it a brain cell or a kidney cell? Is it gasoline or kerosene? Is it gluten or dairy or mold or heavy metals? It's always inflammation, always at the cellular level for every degenerative disease that I know of. So we want to reduce the amount of gasoline on the fire, the amount of petrol on the fire. And the most common source of inflammation for practically all of your patients, the most common source is what is on the end of their fork, what they're eating. So this is a time to emphasize to our patients the critical nature of the colors of the rainbow. The deeper the color of the rainbow, the more polyphenols in that food. We've known for years that if you eat 1 cup of blueberries a day for 3 years, by the end of 3 years, your brain is working as well as it was 13 years earlier. Just read the science. I mean, it's very clear. We know this. We know that polyphenols, the polyphenols in berries and in some of the foods that I'll show you, they inhibit the binding proteins of this virus from binding onto the ACE2 receptors on the surface of your cells. Polyphenols are very powerful to protect you from the virus getting inside your cells. The more polyphenols, the better. I don't know if it's possible to eat too many foods that are high in polyphenols right now. I don't think that's possible. Perhaps, but too much water and you drown. So perhaps it's possible, but I would rather err on eating as many colors of the rainbow, Mrs. Patient, as you can, as many colors as you can. Several studies in animals, in humans, have suggested red-colored foods and their isolated constituents assist in reducing systemic inflammation, bolstering your immune system by reducing infections. They enhance the innate immune system function. Polyphenols enhance the innate immune system function. They increase macrophages, they increase natural killer cell numbers, they increase natural killer cell activity. So in this paper that I'm giving you from our friend Dr. Deanna Minnick, She published this wonderful paper that talks about fruits and vegetables and the colors of the rainbow. Here are those, just the reds, and what phytochemicals are in them, vegetables and the fruit. Every one of your patients should be having 2, 3, or 4 of these every day. So what we're doing, my wife and I, we're taking an orange, we cut an orange in half, we squeeze half the juice, we squeeze the juice from each half in a glass with some ice and water, and we're just sipping this orange flavored water all day, amongst other things we're doing, but we're just making sure to get some of the narinogens from oranges. You do the same with grapefruits to get some of the narinogens, which enhance your immune system function. Vegetables, I'll talk more about vegetables later, but all of them are great for you. We want to educate our patients in simple things they can do. The more colors of the rainbow they're eating, the more support they're giving to their immune system. And Dr. Minnick's article has this page of all of the different vegetables and the fruits, and then a second page for 115 total different fruits and vegetables. And do they have lycopene? Do they have beta carotene? Do they have the luteins? Do they have the folates? So you can give this to your patients and say, just circle the ones that you have every day and make sure tomorrow you get some more. And the more they eat, the better. And here's a page of the colors of the rainbow and what phytochemicals are in each of the different colors of the rainbow. Once again, I'm giving you these articles. Here are the blues and the purples that act as cognitive support, enhance your immune system function, enhance your moods. So we can prepare our vegetables in ways that we like. We have, we all know how to prepare vegetables, but I just want to remind you, microwaving destroys 97% of the flavonoids and the polyphenols. Do not microwave your vegetables, you kill them. What I use a microwave for is I put the sponge from the kitchen sink, we wipe down the kitchen sink and all with sponges. I put the sponge in the microwave because it kills it. When you nuke it, it kills everything. That's what microwaves do to your food, so you do not want to microwave the food. Steaming has minimal loss, that's the ideal way, or eating some of them raw. Now, I want to remind you this paper that came out way back in 2004, the polymeal. There had been a paper that came out 8 months before this called the polypill. Reduce cardiovascular disease by 75%. And they looked at studies and came up with this theory. If you made a polypill that had 5 different medications and some folate, some B vitamin in it, you would reduce cardiovascular disease by 75%. No, I think it was 84%. And so they were advocating this polypill. Well, a group of authors came out 8 months later with the polymeal, using the same logic that the authors of the polypill use. And what did they show us? They showed us that pharmacological interventions are not the only option for preventing heart disease. That if you eat these 7 food components, the studies are very clear, you reduce cardiovascular disease by 75%. Now, obviously, when you're doing that, you're enhancing your immune system. That this is not target specific to one system of the body, this concept of a polymeal, but they focused on cardiovascular disease for this article. A little bit of dark chocolate every day, and everyone smiles when I tell them that. But here's how you do dark chocolate. You take a square of the best dark chocolate you can find, and you put it in your mouth. Don't let it touch your teeth. Do not chew it. Do not chew it. Just let it dissolve in your mouth. And the taste buds register chocolate. It goes up to via the oral thalamic tract to the brain, and your brain says, chocolate's here. Chocolate. And you start producing the endorphins and enkephalons that are 200 times more powerful than morphine. And you keep stimulating the orothalamic tract, and your thalamus keeps getting that message. And it takes about 2 to 3 minutes to dissolve a square of chocolate in your mouth. And if you want another square of chocolate, have another square. I've never had a patient have more than 2 squares because they feel saturated, they feel fulfilled. Now, when you chew and swallow, you can eat an entire bar, then you gain weight, then you throw your blood sugar out of balance. So just a square, don't let it touch your teeth. And every day, have the best chocolate, dark, only dark chocolate. Milk chocolate does not have the same effect. So is chocolate, a little bit of red wine every day, fish 4 times a week, nuts, they were almonds, a little bit of raw garlic, some fruit and vegetables, about 400 grams of fruit and vegetables a day are known to have a positive effect. And what did they show? So here were the percentages of reducing your risk of cardiovascular disease with each of these. Every patient can do this, every patient. You can have every one of your patients moving in the direction of this. Notice there are no potato chips here. There's no canned SpaghettiOs or canned beans here. Nothing wrong with canned beans once in a while, nothing wrong with it, but no convenience foods here. That's how we want to educate our patients. And the results of the polymeal, an increase in life expectancy free from cardiovascular disease for men of 9 years, and for women, 8.1 years, irrespective of their genetics. It was across the board when they ate from the polymeal concept. Number 2, vitamin C. Vitamin C has a pleiotropic, means many different ways that it benefits you. But there's evidence supports the protective effect of high-dose intravenous vitamin C during sepsis-induced acute respiratory distress syndrome. They're using vitamin C now in a number of hospitals in the US. They've been doing it in China for months, and they're doing it in Europe. Vitamin C reinforces the maintenance of the alveolar epithelial barrier, and you can read the other things that it does here include clearing alveolar fluid. Vitamin C is critical for the function of your alveoli. High-dose intravenous vitamin C has been implicated in reducing plasma cell-free DNA formed from the neutrophil extracellular tract, which is the facilitator of systemic inflammation. So high-dose intravenous vitamin C reduces the trigger for sepsis-induced multi-organ failure. It's reducing the amount of inflammation, thus reducing multi-organ failure. Elevated levels of syndican-1 in the plasma correlate with increased mortality. High-dose vitamin C lowers significantly the level of syndican-1. So you lower the risk of mortality. These are for the people going into intensive care. If you have access to high-dose vitamin C in your hospitals, very, very helpful. If you don't have access, call the hospital administrator now. See if he can get some in case you need it. We identified 18 relevant controlled trials with a total of 2,004 patients. Look at the title of this article. Vitamin C can shorten the length of stay in the ICU. They looked at 18 trials of 2,000 patients. Orally administered vitamin C in doses of 1 to 3 grams reduced the length of intensive care unit stays by 8%. I personally am taking 4,000 units of vitamin C. I do it every day, but now I'm doing 4,000 units twice a day. In 3 trials in which patients needed mechanical ventilation for over 24 hours, vitamin C shortened the duration of mechanical ventilation by 18%. Vitamin C is one of those safe, effective, inexpensive protocols that can help. Given this insignificant cost of vitamin C, even an 8% reduction in intensive care unit stay is worth exploring. The effects of vitamin C on ICU patients should be investigated in more detail. Vitamin D. One of my coffees with Dr. Tom was to D or not to D. A little bit of a joke, but Very interesting, the studies on vitamin D. The former CDC chief, Dr. Tom Frieden, came out 2 weeks ago and said vitamin D may be helpful in reducing your risk of infections when you're exposed to the virus. So in this study, vitamin D deficiency has been reported to increase predisposition to systemic infections and impaired immune response. I'm going to back up a moment to show you the title of this study. Look at the title, Preventing a COVID-19 Pandemic Because of High Prevalence of Severe Hypovitamin D in Italy. And I'm going to show you one of the reasons why Italy has a higher mortality rate when they're exposed to the coronavirus. This comes from the British Medical Journal. The huge amount of the population with low circulating vitamin D levels in Italy is due to the historical fact of a lack of a program of food fortification. The government did not mandate that manufacturers have to put vitamin D in the food. There is no fortification of the food in Italy. This is at odds with what's been done for several decades in many European countries, leading to what's called the Scandinavian paradox. What is the Scandinavian paradox? The Scandinavian paradox is that the Scandinavian countries, much further north in Europe than Italy, have higher vitamin D levels than the people in Italy do. And the result is the incidence of severe infections from COVID in the Scandinavian countries, the percentages are much, much lower than in Italy, much lower, dramatically lower. We think reasonable a message reinforcing the importance of maintaining vitamin D treatment in those already who have low vitamin D. I'll talk about how to determine that. Vitamin D enhances cellular natural immunity by reducing the cytokine storm. Now, I learned about this, and look at the title of this article. Evidence that vitamin D supplementation could reduce the risk of influenza and COVID-19 infections and deaths. I read an article about 8 years ago, I think it was. They found 4 people who were buried in the Arctic tundra in Alaska on an army base who died in the 1918 flu. They dug them up and they did autopsies on them, and they identified the cytokine storm in the lungs, that macrophages just produce excessive amounts of cytokines, and these people died in 1 day, 1 to 2 days. They were healthy, 1 to 2 days later, they were gone. Then I read another article that showed, and the way I explain it to my patients is that macrophages in your lungs are the first innate response. They're like special forces firing a chemical bullet called a cytokine to destroy the bacteria or to destroy the virus that has come into the lungs. It's a good thing. We want that. Our immune system's protecting us. Those that get exposed to the virus and have no symptoms, they've got good functioning macrophages and natural killer cells. They never knew that they were exposed. That's what our innate immune system is supposed to do. But what happened for people who died in the 1918 pandemic, their high-powered rifle, the trigger got stuck and became a submachine gun. Pop, 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 pop. That's a cytokine storm. And this paper in the journal Blood showed that the spring on the trigger of the rifle of macrophages, that spring is completely controlled, modulated by vitamin D. So when you have low vitamin D levels, you're at risk of your macrophages becoming submachine guns, producing a cytokine storm. That's what this article talks about. To reduce the risk of infection, it's recommended that people at risk of influenza and or COVID-19 consider taking 10,000 units of vitamin D3 every day for a few weeks to rapidly raise their levels, followed by 5,000 a day maintenance. Vitamin D is known to mitigate the scope of acquired immunity and regenerate endothelial lining. This may be beneficial in minimizing the alveolar damage caused in acute respiratory distress syndrome. Look at the title of this paper that came out just 8 days ago. a comprehensive literature review on the clinical presentation and management of the pandemic virus. And they're telling you vitamin D mitigates the scope of this. It's going to reduce it. Level 1 evidence on 11,000 people show that there's a 12% overall protective effect of vitamin D against bacterial and viral acute respiratory tract infections. These protective effects increase to 19% in those individuals on the daily or weekly regimen of vitamin D compared to those on a monthly bolus. There's a 70% protective effect when vitamin D deficiency is corrected with supplementation. I think the most important test that you can do is to test your vitamin D level. The goal should be to raise your vitamin D level to 40 to 60 nanograms per milliliter, or 100 to 150 nanomoles per liter, depending on what your laboratories use as their markers. For treatment of people who become infected with COVID-19, higher vitamin D3 doses might be useful. Vitamin D supplementation was safe, reduced the risk of experiencing at least one acute respiratory tract infection, protected against acute respiratory tract infections overall. This meta-analysis of many different papers. Look at all the authors on this paper and all the different universities they're from. For treatment of people who become infected with COVID, higher vitamin D doses might be useful. So in our office, and what we do is we do blood spot tests. We send the patient the kit, they poke their finger, put a drop of blood on the card, wait for it to dry, and then mail it directly to the lab. And in 3 to 5 days, we've got their vitamin D level. If you have access to that type of laboratory procedure, great. If not, when your patients can come to the office, do vitamin D tests. Critically important to do vitamin D tests. It's the one test I recommend to everyone every year. Mrs. Patient, cholesterol, it's good to check your cholesterol, but the most important one is vitamin D. More important than any others to check on a regular basis. What about